Hello everybody and welcome to part 2 of the low back pain webinar. We're very excited and we thank you all for tuning in today, or if you're listening to the recording. Today we'll be covering an advancement and hopefully more practical tips around the mobility, the strength and some lifting techniques to help combat low back pain. So this is us. You can find us, we're both osteos. You can find us at McFarlane Clinic in Bayswater North. Lou's currently working at the moment and I should be back in the next couple of weeks. So very excited to get back, and that's where you can find us and connect to our socials as well as we update them. Alrighty, just before we begin, just a quick disclaimer that this is all just general advice only and it may not apply to your specific circumstance. So please consult an osteo or a medical professional if you have any concerns about your health or pain. Lovely. So what are our goals today? Change the goals, but thought it'd be funny to keep that photo of the goals in this week. Our goals are to learn about the principles of how and why we stretch our low back. We want to learn about the strength and lifting techniques that may reduce the strain on our low backs. Lovely. So let's start on the benefits of stretching. The benefits of stretching include increasing flexibility of muscles and range of motion at the joints. And if we can improve that flexibility and range of motion, that helps with increased physical performance as well as decreased risk of injury. We know that stretching also is really helpful for stress relief. Okay. Now, two important points I want to make clear are the bottom two. So with stretching, we do know it's very easy and it is very accessible to do. Okay, it's not like a big gym workout where you might need a bit of equipment. Okay, it's very easy and you can do it in the comfort of your own home, in your office chair, so it's very easy to do. And we know stretching is a great way to manage your low back aches. So going back to what Luke was talking about last week about what causes low back pain, we know that most of the pains that we see are due to your tight muscles, which influences dysfunction in the joints, which causes pain. Alrighty, and then we know that stretching can help to influence and help to stretch out those muscles, which will then take the load off the joints and therefore help with managing of our pain. So we know that can be a very beneficial way of managing our low back aches. So if we're doing that, we're doing pretty well. Okay. So instead of giving everyone kind of a recipe of what to do, I kind of wanted to just give a bit of background about how osteos kind of break down movement and how we kind of describe and what we aim to do in stretching. Okay, so there's three types of three planes that the body can be broken up into, and that helps us to describe the way we move. Okay, so in sagittal plane here, we'll start with the sagittal plane. You can see in the green box there, when we're moving in the sagittal plane, we're bending back and we're bending forward. So that's going to give us flexion when we bend forth, and when we bend back, that's going to be our extension. Okay, so let's talk a bit more about that flexion extension. I've got a little my mate Bryan in the corner there, and he's just going to help you remind what flexion and extension looks like. Okay, so it's the bending back and the bending forth of the back. So tasks requiring you to bend back and forth commonly include picking up items off the floor, gardening, moving boxes, putting on shoes, socks, or sitting. So they're the common things that we see that need your bending back and forth. And here's just trying to show you what I mean. So bending down, flexing down, and then as I come up, I'm extending my back to stand back upright. And then when I'm bending back down, that's when I've got more flexion and extension to kind of finish off what you see in the video there. So the question might be, how can we get flexion extension? So instead of just giving everyone like a recipe, what I'm going to do is just give a couple of ideas about how we can get this stretching. So in a seated position, we can do it. So what we do, put our hands out, try and reach as far as you can forward, and then down beneath your legs, go on as far as you can, feeling a stretch all down the back. And then when we're coming up to extend, we want to try and really push that chest out and make like a backwards C with our back. Okay, so if we're bending forward, that's a C. We're trying to bend backwards and make that backwards C. So that's how that works in a seated position. We can also do it in a kneeling position. So we know that Luke showed this one last week, and this one's called the cat camel. Okay, so we can see that it looks like a camel's back, and as we're rising and we're flexing to the back, everything's bending forward. We're looking kind of like a cat. So to do that cat pose, we're trying to really push up through our chest and then bend forward through that low back. And then when we're going down to the camel position, we really want to just look up and drop through our kind of mid back there. So everything's kind of looking like it's bending back like that. That's another way of getting that movement. We can do it in a lying position. So we can do this one to get flexion. So when we're lying on our knees, we can use our hands and then just crawl our hands forward as far as we can, for them to stretch all the way through the low back there. Or if we wanted to go the other way and extend through the low back, we can simply just lie on the floor and push our chest up, and you can see that that's a nice curve at the low back there, helping with extension. So that's one of the movements that we kind of break down. So we'll look at. Another one we can look at is what we call side bending. So side bending, instead of happening in the sagittal plane, side bending happens in the frontal plane, which is the purple shade there. So when we bend from side to side, we can expect it to be a side bend to the right. Our right shoulder is going to drop towards the floor. If we side bend to the left, we're going to go the other way. So, little GIF here to help everyone, remind everyone what side to side or side bending looks like. So if you ignore the hands, we can just see through the back that our shoulders are kind of dropping and we're side bending through our low back there. So tasks that require side to side movements include picking up an object to the side of you. They can involve carrying heavy grocery bags, and we can see in the lady in the picture there, she's a bit side bent to the left, because we can see that the bags is a little bit low on the left, so the left shoulder's lower to the ground, so she's a bit side bent to the left. And then we can also know that overhead movements such as reaching to get your washing from above you, nailing roofs, or changing lights, that's going to involve a fair bit of side bending as well. Lovely. So how can we get side bending? We can do it in a seated position again. So if we're trying to stretch, get some left-sided side bending, we put our right hand forward, up as high as we can, and then bend over to the left-hand side. That's going to stretch the right side, but that's going to give us left side bending. Do the same thing on the other side. So left hand up to stretch our left lower back, and we're going to bend to the right. Awesome. We can also do it in a standing position, so we can use it with a stick. So the reason why we hold it with a stick is when we move, it kind of encourages our whole back to move as one. So when we use the stick, that kind of connects it all together, and again, we're just moving from side to side, nice and slowly. When we're doing our stretches, we kind of want to feel like that, you know, that nice, comfortable feeling of like, it's a bit, uncomfortable feeling, but you know it's a nice feeling because it feels like a nice stretch. That kind of feeling is what we kind of want to feel every time we stretch. So we don't want to push it past that or to where we're feeling pain, okay, but we should be feeling a nice stretch as we're going through that uncomfortable kind of nice but uncomfortable kind of feeling. And yeah, that's just going to be the best way to stretch it. The last plane of motion, when we're describing these basic planes of motion, is our rotation. So we know that rotation can also be called our twisting. Okay, and this one happens in the horizontal plane. So we can see that in the light blue kind of shade there, and we get rotation when we twist right and when we twist to the left. Awesome. So what does rotation look like? Again, got my mate Bryan up there helping us. If we ignore the silly hand gestures, we've got a nice bend through the back, right and left. So that's our rotation or our twisting. So tasks that require rotation would involve like a machine or a checkout operator. So you can see this lady in the green there, as she's trying to get the item to scan, and she'll be going from right rotation because she's twisting to the right. She'll scan it and then she'll rotate to the left. And so that's going to involve rotation. We can also see that rotation is prominent in the golf swing because we need to get the big wind up and then the follow through to generate the power. You can also know rotation is needed when we are reaching for something at our desk, as well as when we're walking, we're changing direction. That's instigated by rotation of our spine. Or the twist of the back. Awesome. So how are we going to get rotation stretching? We do it in a seated position, so we can twist side to side and use our hands to kind of reinforce that stretch. Again, feeling that nice kind of comfortable position, that nice uncomfortable feeling, and just engage that kind of stretch, nothing too far, and it shouldn't be painful. Yeah. We can do it standing with a stick. It's pretty straightforward, just twisting it to side to side. And again, I prefer those two, but if you have to do it in a lying position due to pain or whatever, you can have your legs up like that and twist side to side, or you can also put your feet on the ground and twist side to side. Okay, so that's the basis of how we describe movement. Okay, but we know that when we move in day-to-day activities, we actually move in more than one plane. Okay, it doesn't just happen that we just twist in rotation, or it doesn't often happen that we just bend back and forth in one direction. So we can see from this lovely dancer here that when he's kind of coming down, he's adding a bit of rotation, a bit of flexion to his spine, and as well as some side bending. So just trying to explain here that the movements is happening in more than one direction. This next one here with a golfer, hopefully that's not me when I return back to golf, when it's all safe to do so. But you can see that as he's twisting to throw the bag, he's got an element of his back arching back as well. Okay, so it's a mix of his twisting to the left and a mix of him arching back. And that arching back and the addition of those two movements is what actually allows him to get more power. So if you can imagine, if it was just a twist and just a throw, he wouldn't be able to generate as much power as when what he's doing there with the twist and he's bending back as well. So it's really important that when we move, it's multifactorial, and yeah. And this is just a cool kind of movement, a bit trippy, but yeah. So that being said, we've given you the basics to stretching. Okay, so the best thing you guys can do is to actually use it. Okay, so we know that if you do it consistently and you do it properly, you should get a lot of relief for those niggly, just those small low back aches that you get from time to time from sitting. Okay, so yeah. Moving on to a case study now. So we're just going to see a desk worker. We've got 35-year-old Gary here. He's a full-time office job. New desk at work the past month, extremely busy with COVID-19. He only gets up twice a day for toilet breaks, and he only stretches when he makes his morning coffee. He started getting low back pain 2 weeks ago, and he presented with no pain down the legs and the feeling that his back needs to be cracked. So what are we going to do? So a couple of things we can do. We're going to make sure that his desk setup is right. So if you didn't get a chance to tune in last week, make sure you have a look at that, about the optimal ways to kind of set up your desk. We're actually going to set up an alarm on his watch and his computer to remind him to get up every hour. So every hour there's going to be an alarm, and it's actually going to tell him to get up and stretch, because I have found that this is the most effective technique to get people to actually do things consistently. We know that Gary's really, really busy, so we're just going to educate him that it's okay that you're busy, but it's important that you move, and you move consistently throughout the day. Okay, don't get to the end of the day and then feel pain and be like, oh, I should be stretching. It's best that even though you're busy, just find a couple of minutes here and there to get moving consistently throughout the day. He's only got 2 minutes to spare per hour, so we're like, that's okay. Anything is better than nothing as long as you do it. Okay, so as long as you're stretching, Gary, we're happy with that. So all we're going to give you is 10 stretches in each direction. And then we're going to also prescribe some strength exercises that Luke will show very well very soon. Okay, so we're just going to get him to do 10 in each direction. So he's at his desk. He doesn't like to be on the floor with 30. So we're just going to get him just doing those bends forwards and back in the chair. 10 each direction, okay, every hour. We're going to get him to rotate 10 in each direction every hour in his chair. And then also we're just going to get him to bend side to side. And we know that if he does this consistently every hour, it's going to go a long way in kind of helping him reduce his pain. And then we know when we add a bit of a strength component, that's going to really help in the long term to hopefully manage his low back aches. So I know this one's on the low back, but we've got a couple of hip muscles that I also tend to prescribe these stretches. Okay, so the first one here is the psoas muscle, or the hip flexor. So what we're seeing here is we're looking at the person at the front, from the front here. This is the person's right hip. there's a person. And then we can see the spine there, right down the middle and attached to the pelvis. So the muscles, you can see that muscle runs from the hip and it kind of runs up and in an upwards diagonal direction to the spine. So that spine there is the low back there. Okay? And why this is important is if we look at the green line, that's how the psoas muscle will be positioned when you're standing. What happens is when you kind of sitting down, you can imagine the hip kind of comes up, and what we're doing is we're actually shortening that muscle through the hip there. Okay, so that muscle has become shortened, and because it's become shortened, it doesn't function as well, and that can be a source of his low back pain. Okay, so what we're going to do for this is we're going to do a hip flexor stretch. So really important, the first thing you do for a hip flexor stretch is you kind of do that posterior pelvis tilt. So you can see when I tuck my pelvis down and under, that's going to put that muscle kind of engage that muscle. Okay, and then once we get that engagement, you should feel a stretch straight away. We're going to move our hip forward in the forward direction and feel in a stretch through there. You can see that I'm not arching my back at all. A lot of people, when they do this, they don't get that tilt underneath. And as a result of that, they really load through their back to try and get that stretch. Okay, so this one is a good one to prescribe as well. The last one is your glute muscle. Okay, so your glute muscle, largest muscle in your body. Okay, and they have a massive function in helping to stabilize your pelvis when you're upright. Okay, so when these muscles they attach onto the hip and very closely related with the pelvis. So if you're sitting on them all day, not engaging them, that can have a domino effect, causing you to have altered movement through your hip and your pelvis. And then as a result of that, that can come up to the back that's very closely positioned. So this is a muscle that we want to stretch out, but Luke's going to show us how to strengthen it as well, which is very important. So just simple stretching, pulling that left. So we're stretching the left side. You can pull your left knee to your left shoulder, maybe 5 or 6 times, and then you can do it to the right. And that's just going to get different parts of the glute muscle, but a good muscle to stretch through there. Finish off with a couple of things just on stretching in general. Some people ask, do I stretch statically or do I stretch dynamically? What does this mean? So when you stretch statically, you kind of just find a position of the stretch and you hold that position, right? Whereas in you stretching dynamically, you're kind of stretching that movement back and forth, okay? So there's no evidence to say one's more supreme over the other. Very strong evidence. But what I like to prescribe is more dynamic stretching. So we know that the nature of our lives nowadays is really static and we're really, really still. And we know that the body is very dynamic, you know, it's very, it should be designed to move, you know. So anytime I would say pick one, I'd pick dynamic. Okay, so that's my kind of thinking behind that. How long should you hold it for? So if you're doing a static stretching, again, there's a whole lot of different research. I'd probably say around 45 seconds. I think there was a study that say that if you hold it for longer than that, then that can inhibit physical performance. And then with dynamic stretching, I normally just say I aim for 10 each side. Okay, so 10 kind of small twists, and we do 2 to 3 sets, and that's governed by how much of a stretch you're feeling. So after the second set, if you're feeling like you're not getting as much of a stretch, then I'd probably leave it there. Whereas if you're going after that second set and you're still feeling quite tight and you're still getting that nice kind of stretching kind of sensation, and I'd do another set. Okay. How often should you do it? I'd kind of say if you sit more, you stretch more. Okay, because if you're sitting more, you're just more still and you just need to get moving. So if there's anything I want to harp on to about today, it's just to do it. Okay, me and Luke are going to harp on that today. We've given you a lot of the resources, but if you kind of do it, you're going to notice a big difference. So finish off with key tips for stretching. You want to stretch in the 3 planes when we break it down. So flexion and extension, bending forward and back. We've got our rotation, twisting right to left. We've got side bending, our side to side. So that's what we want to aim movement in those 3 planes. Stretching is very easy, and I hope I'm showing that it's very easy and accessible. And we know that it's a great way to reduce pain in the short term. If you're working from home, make sure you're having your breaks every 30 minutes to an hour. Set that alarm clock so you know it's time to move, okay? And it's good to mix a couple of stretches with strength exercises, which Luke is about to show. And last but not least, just do it, okay? So I'll just, Luke, this is it for the mobility stretching kind of part. So did anyone have any questions? Or we can hold off to the end.
If you've got any questions, throw them in the chat box. We can answer some now about Bryan's part, or we can, if you come up with anything. All right, one here from Sam. Bryan, standing desks. Do we recommend them?
Yep. So standing desks are a great way to kind of mix up our position when we're working in our desk. Okay. So obviously, anything that we can do to change that. Basically, the body's not designed to kind of sit in the same position for a long time. Okay. So anything you can do that kind of changes sitting and then standing, that's good because that promotes different movements and different strains on the body. So I would say standing desk is good. It isn't the magic pill to kind of stop your back pain. Okay, if you've got the desk, you still got to make sure you do your stretches because even though you're standing, you're still in a stagnant position.
Yeah.
Okay, and our bodies are used to move. So yeah.
I was practically going to say the same thing as Bryan just said there. I would say not just go straight to a fixed standing desk, have a vary desk or an alternating height desk where you can sit down for an hour and then stand for an hour and then sit for an hour and stand for an hour. So that way you're getting the movement and you're not just, as Bryan said, stagnantly standing, because you'll end up with the same issues if you were stagnantly sitting. So get if you do want a standing desk, they are great, but get the variable height ones that you can adjust throughout the day so you can keep shifting your position.
Heat versus ice before or after stretching.
Ooh.
It would depend what for.
Yeah, why are
you? Yeah, it depends what you're doing. Are you stretching just for flexibility, or are you doing it before sports, or are you doing it after sports? So that one have to be dependent on it. Heat versus ice. We normally say ice, for the first 24 to 48 hours. If you've just suffered an acute injury, meaning you've just got a new injury. But I find that heat works really well on the back. So anytime you've got a backache, I like to prescribe heat because I find it's just a lot nicer on the skin and it just gives that pain relief, which is what its main role kind of is as well.
I think in terms of the injury management stuff, the evidence on ice is now starting to be a bit hazy, as in it might not be doing what we think it is doing, and it may not be that beneficial in times. In terms of things before stretching, or I'm going to say before exercise here, I would not be using ice before exercise because you want the blood flow and you want the warmth in the muscle before you perform an activity. So if you want to use it before an activity, use heat the body up a bit more. I wouldn't be using ice at all before an activity. Alrighty. Have we got anything else on this part of the presentation? Nope. All right. Well, thanks, Bryan, for that. I'm going to stop your screen share. I'll go onto mine. Like that noise. So Bryan's done a very good job there talking about mobility work for your lower back. Now I'm going to be talking about strengthening exercises and lifting techniques for the lower back. So these go hand in hand with mobility work. I like to call this the exercise strikes back. And for those that are Star Wars fans, that's a bit of a nod to episode 5. I've got my nerd hat on here. There we are. There's a bit of Yoda. All right. So what we are going to cover today, we have essentially these top 4 exercises are your core strengthening exercises. I'm not going to go on a rant about core stuff because I could be here for ages. And then the next set of exercises are more of your hip glute strengthening exercises, as well as incorporating lifting techniques in the last 2. So, but before I start talking about that, these exercises, especially those lifting ones towards the end, should be best learnt under direct supervision and direct technical advice. Shouldn't learn how to do these from a webinar, from a video. I'm just aiming to give an overview of certain key points to remember when doing these things. I'm not here to instruct you specifically how to do it. It's best to learn these in person from someone that knows what they are doing. And I will harp on about that as I go through as well. Alrighty, so first of all, we're going to talk abdominal bracing. A lot of you have probably heard this term, you know, activating your core or engaging your core, that sort of thing. And the way I've started giving this to clients is a pushing out of the abdominal muscles. Traditionally, it's been about sucking in, you know, bringing your belly button towards your spine, or drawing your oblique muscles, the ones at the side here, in towards your spine. That does sort of hold the spine, but then it also restricts your movement. With the pushing out, the expanding out technique, you are still able to breathe and you are still able to move around. The way you do this is, as you see in the picture there, have your hands in at your side and just gently try to expand those muscles outwards. Give it a shot now. It's a little bit difficult to do initially, but you can practice it and you can get good at doing it. One of the key ways I like to say is think about being prepared to be punched in the stomach. What happens then is you don't suck in, you expand out, you brace yourself and you expand yourself out. As you get good at doing this technique, you'll then be able to incorporate it into the other exercises that I'm going to show you, and also just in day-to-day activity. If you're having to lift a pot or something like that, engage through the abdominal brace before you do that. The next set of exercises are termed the Big Three. And these have been termed the Big Three by Stuart McGila, not the ex-Australian leg spinner, if you follow your cricket, but he's a Canadian biomechanist who studied the spine a lot, and he suggested that these three exercises are great for increasing strength around your spine, but also for when performing them, they don't have that much stress placed on the spine. So if you've got an injury or a pain in the area, it won't aggravate that too much. The first one of these three exercises is the modified curl up. And as you see here with the animation, it's not a sit up. You're not crunching your chest up towards your knees. And the reason we're not doing that is as you do that sit up, you start putting increased force through your lower back, and that can cause some pain, especially if you've had an injury. What you are doing is just a very gentle contraction through your upper abdominal muscles, so right underneath the base of your ribs. And as you're doing that, you're lifting your head up off the floor and your shoulders come off, and that's about as high as you're going. You're trying to maintain a natural arch in your lower back. That's why your hands are there. If you can feel your lower back pressing down onto your hands, you've probably gone a bit too far in the movement. Word of warning though, because of the way the neck is unsupported, if you do have a neck issue of some form, it may aggravate that. So you can perform some neck strengthening work before we start incorporating this. I'm not going to cover the neck today though. So that is your modified curl up. The next one in the Big Three is your side plank. Very common exercise and a very good exercise as well for strengthening your oblique muscles, the ones around the side here, and also your QL muscle, which is, I guess you could call your flank, your side of your back. We're doing this position for a hold. You hold it for 10 to 15 seconds and then relax, 10 to 15 seconds, relax, etc. Some key points. You're wanting to try to maintain a straight line between shoulder to hip. So no sagging down of the waist and definitely not pushing up high on the upper hip. If you find that it's too hard, we've got the staging for this exercise. As you can see down here, this lady's performing it off her knees with a foot support. That's an easier version than up here, doing it completely off your feet. If you find that this one's too easy, but this one's too hard, you can bring this top foot down and support that on the floor, and it just adds a little bit more balance. Another key point to make with this exercise is you're trying to have the upper shoulder and chest not roll forward. You want to keep a straight body throughout the whole exercise. So that is your side plank exercise. The final one in the big three is a bird dog, and this is the most difficult one to do and to do correctly. Interestingly, when I was making this presentation, I wanted to find out why it's called a bird dog, and apparently it's because it looks like hunting dogs, the position hunting dogs make when they spot a bird that you've shot and are pointing it out. Go figure, use your imagination on that. With the bird dog, as you can see in the animation, you're starting in a hands and knees position. Generally, knees are underneath the hips and hands are underneath the shoulders. From this position, you are then raising your opposite arm and opposite leg into the air, trying to keep your hips level and your back stable as you are doing this. Before you do those movements though, it's probably best to engage that abdominal brace that I talked about earlier. As you are lifting the arm and leg, try not to lift them above shoulder and hip height respectively. That avoids too much spinal compression and extension movements. You want to just keep a nice straight line. Again, this is a brace and hold position. So you get out into the arm out position, hold that for 10-15 seconds, bring yourself down. The guy that proposed this as part of the big three, Mr. McGila, he actually suggests using a clenched fist and the toes pointing as they are in this demonstration here, because according to his research, it actually activates your muscles in your back a bit more and provides a bit more strengthening work. I haven't tried it like that myself as yet, but it's an interesting take on the technique. This is a hard one to do correctly, so this is one where you definitely start needing some technical guidance whilst you're learning how to do it. All right, I've already kind of talked about this, but with those big three exercises, they are holds. They're not up, down, up, down, up, down repetitions. They're holds for 10 to 15 seconds. I say up to 15. Mr. McGila is saying 10-second holds, and then you repeat that 5-6 times, have a break. Repeat it another 3-4 times, have a break, repeat it another couple of times, done. These set of exercises and the mobility exercises that Bryan talked about earlier are daily exercises. You perform them every day. They're not like the big gym workouts, those heavy exercises where you fatigue too much and therefore you can only do them 2 to 4 times a week. These should be low load exercises. They shouldn't fatigue you that badly, so you can do them every day, even multiple times a day. That's as the key that Bryan was saying earlier, you just do them. You're not going to get any benefit from knowing how to do it, but not doing it. So that is your core workout. Now we're going to move on to hips, being essentially your glute muscles, because these are very important when it comes to function throughout day-to-day life. First exercise is very simple glute bridge. As you can see here, you're starting by laying on your back with your knees bent. I tend to say if I bring my hand all the way around here, if my heel is touching the end of my fingers, that's about a good length of distance of knee bend. That's just a personal thing. I don't think there's anything that says that's good or bad, but that's just my personal take on it. There are variations of this with legs straighter, but that's going to hit more of your hamstring. And at this stage, we're aiming for more bum muscle work. So very brief description of how you do this. From that laying on your back position, push your feet straight down into the floor, squeeze your bum and lift up. Very simple. You can hold at the top for a few seconds. You can hover up and down. You can just do reps. There's many different variations and I'm not going to cover them all off today, but you can just find variations everywhere on the internet. You know, single legs, you can add weight, you can go off a deficit where you've got your legs up higher. You can go off do it into a hip thrust exercise where your back's up higher. But this is a very, very good exercise for starting to engage your glute muscles. One of the things that happens when you have had back pain is that pain inhibits the function of your glute muscles and makes them apparently weak or asleep. You're just not using them correctly. And then that can also then feed back into more back pain. So it becomes a vicious cycle. Back pain equals weak muscles equals back pain, and it just keeps going like that. So if we start using your hip muscles, it will help your back significantly. All right. Now we'll get on to, this is more of a movement rather than a strengthening exercise, but as you'll see later on, it can be easily turned into a strengthening exercise. This is one of the most important movements that I think you need to be able to do to lift things safely and efficiently, and it's called a hip hinge. As you can see in the animation here, the person is bending forward through their hips without bending their back. And what that motion does is it puts all the weight of anything that you might be lifting off the ground onto your hips. The hip muscles, your bum muscles, your glute muscles, whatever you want to call them, should be the strongest muscles in your body. They are designed for power, they are designed for strength. So if you're not using them when you're lifting, you're going to be putting extra strain throughout your spine, and that may lead to injury or pain. The way I prescribe this for people is exactly how it is being done in this GIF here, with a pole held vertically up your back. 3 points of contact, one at your bum, one in your middle back, one at your back of your head, and simply bend forward, but don't have any of that pole come away from your back. This will mean that you have to bend through your hips. Another way you can think about doing it is if you're standing in front of a wall, you bend forward and try to get your bum to move backwards to touch that wall. It's all about getting hip movement traveling backwards, so you're bending without putting too much excessive movement through your back. Again, this is one that you need to have taught to you and have perform in front of someone else so that they can give you technical feedback. Once you have mastered how to do this, then you are ready to start moving into squat movements and deadlift movements, which is what we're going to cover now. Your squat is a very good exercise, and there's many different variations, which I'm not going to cover. The reason I'm talking about it today is not so much so you can go to the gym and lift 150 kilos or whatever you might want to throw around. It's more of the function of getting often on a chair, getting often on the toilet, crouching down to pick something up. If you know how to do a squat movement, you can do those efficiently and easily. The key points I want to say with a squat, again, I'm not going over exactly how to do every part of this exercise, but the key points are, it's a hip exercise. So hip moves first. So the initial movement is a small hip hinge, and then you're crouching back down, like you're going to sit on the toilet, as one of my mates described to me once. So you're gently moving that hip backwards and down, and then as you're going down, your knees will follow and your knees will bend. Don't bend from the knees, bend from the hips, or crouch down from the hips, I should say. And it's the same on the way up. The way up is a push up and forwards from your hips. You're not lifting up through your knees. Another key point, again, we're talking, this is more for spine pain or just general form as well. Try to keep your chest up and looking forward. If your chest is down and you're looking down, you start bending through your spine, and that again may put a bit of extra pressure through the back when it's not necessary to have that. Easy modifications, easy variations of this are a sit to stand or a box squat, where you are literally sit to stand. It's in the title. You are sitting on an item and you push yourself up and forwards to stand up, or you squat back and down to just touch your bum onto the chair, and then you stand back up again. Notice straight back, no just sort of flopping backwards. It's a nice controlled movement. Again, practice this in front of someone, get someone to teach you. All right. The final exercise I'm going to cover today, which is great for general strength, but also great for lifting technique, is your deadlift. Your deadlift is essentially a hip hinge, but with weight. So if you know how to hip hinge, you know how to deadlift. People, I think, get scared of deadlifts because they hear of horror stories. You know, I blew my back out, I did this injury, I did that when doing a deadlift. And yes, they do happen when people don't have the correct technique or they're trying to lift too heavy. So again, I'm not here to teach you how to lift 200 kilos worth of weight. I'm here to just give you some advice as to how you can lift some things off the ground. As you can see here with the animation, the guy is hip hinging. His bum goes back, he collects the weight, and then his bum lifts up and forwards. He's got a slight knee bend so he can get down further towards the weight, and that is perfectly normal and perfectly fine. Again, it's a hip movement, so hips move first in the going backwards phase, they move first in the coming upwards phase. And you notice as well, nice straight back, all the weight is being carried on his hips. Your hips are stronger than your back, use them. Another key point with a deadlift movement, and this applies to lifting things off the ground as well, is as you go to lift it up, just draw back through your shoulder blades a little bit. What happens there is it engages your upper back, engages your muscles around your shoulder blades to help stabilize the upper back, but also it helps lift the weight a little bit. You're not shrugging up, you're not lifting with your shoulders, you're just pulling back gently to engage that upper back to make the movement easier. Again, this is definitely one where if you want to start lifting heavy weights or any sort of weight with it, you need to have someone teach you how to do it. And that is my disclaimer. Get someone to teach you how to do these things. Don't learn them off videos, don't learn them off webinars. Have them taught to you in person. All right, now, at the end of our webinar last week, a question was asked, can we cover ergonomics and lifting technique? And we said yes. And so I'm going to cover that now. But if you've been paying attention to what I've been banging on about, you will already know how to lift. If you know how to hip hinge, if you know how to squat, and if you know how to deadlift, you know how to lift. As you can see here in the animation, this guy is picking up the box. He's using a combination of a hip hinge, squat, deadlift movement. It's like a hybrid, bastardized movement of some form, but he's not having to use his back to lift. He's using his hips. That is a great lifting technique. He's also keeping the weight very close to his body, which is another key point in manual handling of any form. The further away you're holding the weight from your body, the harder it is to hold. It's just a physics. It's just how physics works. So keep items closer to you as much as possible. With manual handling as well, a lot of the time people say, don't bend with your back, bend with your legs, use your legs to lift. I would say that is very correct, but I'm going to change that a little bit and say, not so much lift with your legs, lift with your hips. I've said this multiple times already. Your hips are the strongest part, should be the strongest muscles in your body. Use them to lift. Your knees will follow, your upper body will follow. You move your hips through the motion. As you can see here, he's bent down, he's picking up, lifting, pushing up through the hips, and then you can often walk. You can do this with two-person lifts. You can modify this. The other day I was having to move a big pot in my backyard. There was no way I could lift it, but I was able to crouch down and using a deadlift squat technique, then just roll it around. And I was very comfortable doing that. But if I tried lifting it, I would be in hospital by now. So you can modify. So general principles of lifting: use your hips, know how you hip hinge, know how you squat, know how you deadlift, and you should be A-okay. And that concludes my part of this presentation. Does anyone have any questions on what I've just banged on about? No, it doesn't appear that we do. Oh, no, there's something in the chat there. Oh, that's from a while ago.
Yeah.
Thank you, Sam.
Nice.
And does anyone have any questions about anything that Bryan and I talked about today, or do you have any feedback? Yes, neck and shoulders. We've had many requests for us to do neck, shoulders, upper back, and that will probably be coming in the next few weeks at some point.
Chance. Cheers. Simon.
Yeah.
Right,
Oh, good old
yeah.
chunks. Brilliant. All right.
Everyone.
So as Bryan said at the start, if you want to contact us, and sorry, I'll just answer that question first. Yes, Ninma, we will be uploading this. I did have a bit of I'm recording it, but I did have a bit of a malfunction, for want of another term, with my internet. So I might have missed a couple of minutes of Bryan's in the middle, but we will have most of it. And if I have missed something, Bryan and I might just go over the bit that we missed and talk about it again. So apologies, we had some Optus technical difficulties for the last couple of weeks here. So it will be uploaded and will be flung on YouTube. If there's something we've missed, we'll do it. We'll fix it up. And that should be up, if not by the end of today, definitely by the end of tomorrow. These are our contact details. As Bryan said, we're both osteos over at McFarlane Clinic in Bayswater North. If you want to get in touch with us, fling us an email or slide into our DMs. That's the easiest way to easiest way to do it. Any feedback, positive or negative, will be appreciated. All right.
Yeah, just do it. I reckon that's the best advice. Just get moving, do the stretches, and yeah, do a bit of that strength work, and you'll find that if you can do it consistently, you're going to get some good results. It's not like a magic thing that happens once and you feel better. It's going to be a consistent thing. So
yeah, practice makes perfect.
Beautiful.
Beautiful.
Well done, Luke. That was good.
Thank you, Mr. Bryan. Thanks very much for tuning. Exactly right. I hope you enjoy your weekend, and we'll see you next time, whenever that may be, some point in the next few weeks. Follow us on our socials and you'll find out there.